Obviously, we have some graphics here that I'm going to get into in just a little bit. That's a result of our COVID-19 dashboard related to the hospital census and data that we are receiving on a daily basis from all 14 hospitals in Palm Beach County. Before we get into that directly, I want to give a little update on where we're at with some of our operational factors of the COVID-19 pandemic. As you're aware, the county has been working with the state and local contractors and state contractors to make sure we have as many public testing sites as possible for our residents. We currently have sites open in the following locations: Palm Beach Gardens at the Gardens Branch Library, the Mid-County Senior Center in Lake Worth, the South County Civic Center in Delray Beach, FAU Tech Runway in Boca Raton, Lakeside Medical Center in Belle Glade, and tomorrow, on Friday, we'll be opening a testing site at Gaines Park in West Palm Beach. These sites are open 7 days a week, and they are free. If you have insurance, you can bring your insurance card, please, but you will not have to pay personally. But these sites are closed for Labor Day. As I stated, testing is free, but where available insurance or Medicare or Medicaid programs are available, you will be billed to help cover the cost of testing. All of these sites and more information on other resources available can be found at www.pbcgov.com. Again, that's www.pbcgov.com. Most commercial pharmacies and physicians' offices are able to do COVID testing in a rapid fashion for little or no cost, along with vaccinations. Related to our schools, there are 2 school district testing sites that have opened. The sites will be operated by the Department of Health, and Dr. Alonzo will update you on some of those specifics here in a moment. And they are for school district employees and students. And there are 2 rapid test sites at the following locations for the school district: the Chuck Shaw Tech Center on Westgate Avenue in West Palm Beach, and the West Tech Center in Belle Glade. The Governor DeSantis, was in town today to give us an update on the monoclonal therapy that the state is leading. The state of Florida has set up the monoclonal antibody therapy treatments at the Westgate Park and Recreation Center in West Palm Beach. This site has the capacity to serve about 300 patients per day and is open 7 days a week from 9 a.m. to 5 p.m. Again, those are for COVID-positive patients that wish to undergo that therapy, which in all candor is found to be very effective. There's over 45,000 patients that have gone through this treatment at the 21 sites throughout the state of Florida. We will have some updates on our local efforts to expand monoclonal antibody therapy from a private contractor standpoint, and hopefully we'll have that information in the next couple of days. The healthcare district is offering free walk-up COVID-19 vaccinations Monday through Friday this week from 9 a.m. to 4 p.m. at the Lantana Clinic parking lot at 1250 South Winds Drive in Lantana. Again, it's open from 9 a.m. to 4 p.m. There is no cost. You can walk up. You do not need an appointment. And it's located at Lantana Clinic parking lot 1250 South Winds Drive in Lantana. There is an additional site available at Lakeside Medical Center parking lot, which is in Belle Glade. It's located at 39200 Hooker Highway in Belle Glade. Tonight, September 2nd, at Clematis by Night near the fountain, there will be a pop-up site for vaccinations. And then on Saturday at the Wayne Barton Study Center in Boca Raton will be an additional pop-up site for vaccinations. Local businesses that are interested in hosting Healthcare District's mobile vaccination clinic for your employees and staff members should visit www.hcdpbc.org. Again, if you have a business or you're an employee of a business and you want to assist in bringing free vaccinations to your place of work, you can visit www.hcdpbc.org and then click on the mobile clinic vaccination and community event request button. All right, now that that information's out of the way, we wanted to get into a little bit of the data that we've received from the 14 hospitals under the emergency order. And by way of background, you'll recall that the Board of County Commissioners voted unanimously on August 17th to declare a local state of emergency, and I was directed as the county mayor to execute that state of emergency on their behalf. As a result of that state of emergency, and the real intent behind it was to put an order in place that required the 14 hospitals in Palm Beach County to deliver data to Palm Beach County government on a daily basis. We receive this information on a daily basis, and we have since we opened the portal. It is updated, and new data comes in every day at 11 a.m. I wanted to walk the press and constituents of Palm Beach County through some of the data that's come in and give you an overview of what we're seeing here in Palm Beach County. Again, this data changes on a daily basis. There is some stability involved in the data from a 50,000-foot level, but it does change on a day-to-day basis. And before I get directly into the data, I want to also update you that the Board of County Commissioners on an individual basis had the opportunity yesterday to meet with the CEOs and administrators of all 14 hospitals here in Palm Beach County. It gave us an opportunity as your elected representatives to ask questions, to get clarity, and to get some input and perspective on what's really going on in our hospitals. This data is very important. It gives a very good picture of what's going on, and by very good I mean an accurate picture, but the meetings gave us an opportunity to get a more clear picture from their perspective and from the perspective of the administrators and medical directors. And I'll go through the data and I'll give you what my personal perspective is on what's going on in our hospital system. So there's several data points that are located on this dashboard. You can go to our website and you can click on this. So it's available 24 hours a day, 7 days a week. It's updated daily. The first piece of information is the new COVID-19 admissions since the last report. So that's since 11 a.m. Today, or since yesterday, there's been 87 new admissions into our hospital for COVID-19. Here we have the total COVID-19 adults admitted. That's pretty self-explanatory, 754. And then pediatrics, so that's 17 and under admitted since the start of the data, and that's at 20. This is a very interesting piece of data. This comes, again, all of this comes directly from the hospitals. In the last 24 hours, there's been 79 fully vaccinated patients admitted to our hospital system. And then unvaccinated or not fully vaccinated is 564. And so there's been a lot of discussion and dialogue and debate about what the reality is, whether it's throughout the nation or in our local community, about the true picture of who's going into our hospitals and whether they're vaccinated or not. In the last 24 hours, 564 people admitted into the hospital, or the 14 hospitals in Palm Beach County, were unvaccinated. 79 were fully vaccinated. I think I did the math prior to coming here to the press conference, and it was about 85% were unvaccinated. And that data has been pretty consistent throughout the pendency of the pandemic since vaccinations have been available. We've had 104 people discharged in the last 24 hours. Transfers out of Palm Beach County is one. I can't tell you, and I don't know why that person was transferred out. There are several reasons that they could be transferred out. Oftentimes it has to do with ventilator use, but I'm not suggesting that's what happened here. There's a much higher requirement in terms of how many doctors and nurses need to attend to somebody that's going through that therapy, ventilator therapy. But we have not had any transfers within the county or into our county in the last 24 hours. This number here is important, emergency department bed holds. What that means that there's 116 patients now in the ER that have been triaged, I believe, that are waiting for a bed, but they are holding in the emergency department. So that's sort of the first indication that there are some real concerns as we go through this data regarding the status of availability of healthcare in Palm Beach County. We now presently have 195 people, adults, in the ICU that are COVID-19 positive, and we have 11 children. That's 11 children, 17 or under the age of 17 or younger, that are in our ICU because of COVID-19. It's very clear that ventilator inventory, that it's robust, that we have access to ventilators, but I wouldn't put too much emphasis on that, because it's not simply the ventilator that's effective in saving a life. It's the staffing and the doctors and nurses that go with it. And I'll talk a little bit about some of the staffing issues and concerns we have as a government in just a moment. The other very concerning data point is the total capacity, which is 2,823 beds, and the normal footprint of our hospital system, all 14 hospitals, Right now, they're upstaffing and upsurging bed capacity to 3,033. That means that's a deficit of 210 beds and a 7% deficit from a percentage standpoint. Take from that what you will, but from my perspective, that's very concerning that we have hospitals that are in surge mode in terms of capacity. They are adding beds. They have the ability to do that. They have the ability to upstaff, but we are exceeding the normal footprint of beds in our hospital system, and we have been for several days at this point. Adult ICU capacity, there's 333 beds, but there are 347 in use right now with a deficit of 14 and then a negative deficit of -4%. So what that means is that there are ICU beds that have been added under the comprehensive emergency management plan that the hospitals have in effect, and our ICUs are very, very busy. And again, we can take from that number because obviously not all of those beds in ICU are COVID positive patients, but we can sort of extract from the information, looking at the other 195 and 11, we can subtract from that 333 and see that about 2/3 from my perspective, and I didn't use a calculator, but a very large majority of those in ICU in Palm Beach County are COVID positive. Pediatric ICU capacity, 42 beds, 31 in use, 11 available, and 26% available. But we do have children in the ICU because of COVID-19. And then there's some acute capacity, which deals with the normal footprint of the hospital bed system with a -9% and a deficit of 207 beds available. So those are the statistics and data that we received today. We have a report for each day. The hospitals have been very good to work with. We appreciate their cooperation. The administrators have been very candid and forthright with us and the Board of County Commissioners and the county administrator, which we would expect no less from them. But there are a couple data points and perspectives that I have that I'll go through very briefly, and then I'll have Dr. Alonso come up and speak to some of the metrics to COVID-19 overall. So I discussed the meetings that the individual commissioners have had with the hospital administrators, and from what I took away, the hospitals are very much full. The data bears that out. The perspectives and comments from the doctors and the nurses, and particularly the CEOs and administrators, bears that out. From my perspective, there are chronic staffing issues with healthcare professionals, not just in our community, but throughout the United States. That should come as no surprise. We have been in this pandemic for well over a year and a half. There's increased demand for healthcare professionals, that's nurses and doctors and all the other members of that profession. And there's also burnout that's happening. So as the demand increases and the time goes on, people get burnt out and they leave the profession. As we sit here today in Florida, the Florida Hospital Association reports that there's a deficit of 8,000 nurses in this state. Again, that's a confluence of increased demand and burnout. There is an oxygen shortage. I don't think that's specific to our county. It is true in our county, but it's also true throughout the state of Florida, I believe the United States. That's a sobering perspective. But I will say, and it does come as no surprise, that the hospitals are meeting the challenge. The healthcare professionals are meeting the challenge, and it's very impressive. I remember at the start and during the pendency of sort of the first wave of COVID, long time ago, how much affection and appreciation we showed to our healthcare professionals, and I believe Commissioner Greg Weiss will speak to this in a little bit more detail. But understand that beds and ventilators and capacity are not the metrics that save someone's life or treat that patient when they're in the hospital. It is the healthcare professional, and that is the nurse, the doctor, the respiratory therapist, the person changing the linens on the sheets. I would imagine working in that environment day in and day out with all the PPE, all the protocols, is very taxing from an emotional and psychological standpoint, never mind a physical standpoint. So we'll have a little bit more discussion about this in a little bit, but please keep our healthcare professionals in your thoughts and prayers. At this time, it's my pleasure to welcome to the podium Dr. Alina Alonso from the Department of Health.
Thank you, Mayor. Again, glad to be here with all of you. Thank you for covering the press conference, and thank you for sharing our information with all the people in Palm Beach County that need to help us to get through the continuing days of this pandemic. The first update that I'll give you is our numbers are sort of going up and down. For example, on Friday, we had 13.9% positivity rate. That's still high, even though it's come down a little bit. And what we're going to see is we're going to see this going up and down by the number of the numbers that we have per day. So on Tuesday, on the 31st, we had 812. We were down below 1,000. Wednesday, we had 1,310. So these numbers are going to go up and down. That's what I'm expecting in the next several months to come. We're going to see maybe little peaks and little swoops down, and then come the holidays, it'll go back up again. So we're in this for the long haul. One of the things that's making a difference is the number of people being vaccinated, the number of people taking the monoclonal therapy. And here in Palm Beach County, we've done 2,087 people that have actually gotten this therapy. That is life-saving. We need to do more emphasis on physicians being able to give this out to high-risk patients. They have to be positive, they have to have a positive test, and then they have to be at high risk in order to get this therapy. But it's life-saving because it will help you get over the infection quickly by having those antibodies in your body. It will stop you perhaps from having to go to the hospital, and even if you do have to go to the hospital, you'll be able to come out faster and sooner. So very important. The other thing that I cannot emphasize enough is please get vaccinated. If you haven't done it yet, we all need to get vaccinated. There's no reason for people to be positive now. The vaccine's available. The vaccine is safe. The vaccine is covering all the variants, including the Delta, even though it's 60% more infectious. And it's also making breakthrough, infecting people who have been vaccinated. That number remains low, and so the vaccine is doing its job. Why? Because it's stopping people from getting into the hospital and being really sick. They're getting over it quicker. For those people who have gone into the hospital and who have actually suffered death, most of those are the older population, lots of people from nursing homes and people with immunocompromised systems and other health issues. The vast majority of the people with the breakthroughs, that number remains very low. And even if you multiply it 500, it's still less than what the vaccine says it covers. Remember, the vaccine efficacy is 95% for Pfizer, 94% for Moderna, and 84% for J&J. So even with those numbers of breakthroughs, the vaccine is still doing its job. So please get vaccinated if you're still thinking about it. The numbers that I think are very important here on this dashboard have to do with, one, the thing that I look the most for is how many people are coming in and how many people are going out. You got 87 people going in, 104 going out. That's good. If that continues, that means our numbers will be going down. Also, this percentage of the vaccinated and the unvaccinated. At one point, our CEOs told us about 98% of the people coming into the hospital early on were unvaccinated. Now, as you can see, we're down to 85. That's very good, and it's been maintaining. It's been going down as what? More people are actually getting vaccinated. We have gone up in vaccinations by 11% since July. That is mostly due to the 11 to 19-year-olds getting vaccinated. The parents are taking their kids for vaccinations. We will continue doing that. We're going to have more outreaches for the schools. We've also helped the school district get a site that Mayor Kerner mentioned for them to get tested both in Belglade and here in town so that the parents and the children that are being sent home can get tested quickly and efficiently through their site. This is was with the help of the state, who brought down one of the teams, one of the contracted teams, and they'll be there to do that testing for them. It's very important. So with these percentages going up and down, please continue to do everything that we can. The children that cannot be vaccinated, parents are asking me all the time, when is Pfizer going to be able to do the 5 to 11-year-old? That will not happen probably until late fall, early winter. The parents are going to be ready to vaccinate those kids at that time. But for now, they need to vaccinate themselves so they can protect their children, keep their kids away from areas of crowding, away from parties. There's nothing worse than going to a birthday party and everybody, you know, playing and touching one another and contaminating and spreading the virus. Also be careful who comes to visit at your home, especially now during the holidays. I know it's early to talk about the holidays, but think of people coming to visit you from up north who also you may not know whether or not they're vaccinated, whether or not they're infected. So think of all those things when you're trying to protect your kids and yourselves. With that, I'll just wait for questions and keep up the good job. And please keep in mind all those health professionals that are doing this every day. This is more than exhausting. It's very hard. I can't forget the words that one of the CEOs said when he said, one of the doctors actually said, "It is so sad to see somebody on a hospital bed on a ventilator when it could have been prevented simply by getting a vaccine that's available here in the United States." So please, you don't have to be one of those people in the hospital. Get vaccinated.
Thank you, Dr. Alonso. We appreciate your service and continued leadership. We'll have now our Chief of Fire Rescue for Palm Beach County, Chief Dern. Sir.
Good afternoon. Palm Beach County Fire Rescue continues to provide services as we have always done. Despite the increased volume, despite the increased demand, Palm Beach County Fire Rescue has the capacity to absorb it. That's been a challenge, but we're working through it, and together with you, we can continue to be successful in that effort. We also continue to work with the healthcare district providing vaccinations throughout the county. A little bit about the hospitals. There is absolutely an increased volume in these hospitals. There is absolutely increased patients in these hospitals. We've worked with them to distribute our patients equally throughout the county, as well as going to freestanding emergency departments to help distribute individuals needing help. I just want to reassure you that we're going to get through this together, but we need to also listen to Dr. Alonso. And when she talks about vaccinations, wearing masks, they are extremely important. So please help us get through this. Thank you.
Thank you, Chief Dern, and thank you to your firefighters and paramedics and EMTs for the incredible work they do day in and day out, and all the first responders in Palm Beach County. We'll now have our County Administrator, Ms. Virginia Baker.
Good afternoon. Thank you for being here today. And I want to definitely give a shout out to all the CEOs and their representatives of our hospitals. We've had 14 of them. We have been in dialogue with my staff along with all of them to see how we can assist in any manner. They worked with us on creating this dashboard. We could not have done it without them. And I want to reiterate the fact that we've got our healthcare professionals as well as our fire rescue, our law enforcement on the line every day. The health department, the healthcare district, they're on the line every day. And our workers in the hospital, they're there when their loved ones can't be there. And so they are taking on an additional burden on providing companionship and compassion to make sure that these individuals are worked with till the very end until there is no more to work with. And so that is taking a toll on them. It is taking a toll on their family. And so we as a community can join in and assist in reducing this burden on our healthcare workers. We can definitely get our vaccine, as you've heard, all over the place. We can continue to wear our mask, we can continue to distance, and we can continue to disinfect. So, and also avoid large crowds, because this virus is spreading, and we need to make sure that we're ready for it. We've got hurricane season upon us. And the last thing any of us want is a hurricane to come through here. Our prayers and thoughts go with all of the states that have been impacted by Ida and still dealing with COVID. We want to be blessed so that we don't have to deal with it. Get your vaccine. Talk to your healthcare professional. Follow their orders as far as the vaccine is concerned. You've probably seen that, quote, get your vaccine messaging. In Palm Beach County, we are augmenting DOH messaging as well as putting some of the largest moving billboards out on the road. Palm Tran buses will be now touting our Don't miss your shot. And we've got our athletes, and they will be reflecting this part. We've got 2 local sports stars, part of the vaccine awareness campaign, which we will have more than 500,000 people across the county seeing each bus per month, every day. Buses are going to be running in the glades along the eastern portion of our county as well. All the ads you will see and hear encourage vaccinations. We want to keep our businesses open. We want to keep our people employed in Palm Beach County. And if we don't get this variant, the COVID, under control, we won't have to shut anything down. There will be no one to work, and we're seeing that because some of our businesses are closing. They can't get food in, some of our fast foods, and they don't have the workers to open during normal work hours. So you'll see these ads. If you haven't, please take the time to get vaccinated. We're trying to make it as convenient as possible. A special thanks to Kevin Anderson, a professional tennis player, and Terry Braden, an assistant defensive coach for the Kansas City Chiefs. You will see their faces on our bus. Thank you very much.
Thank you, Madam Administrator. We'll now hear from 3 of the county commissioners in attendance today. We'll start with Commissioner Mac Bernard, then we'll hear from Commissioner Maria, let me correct myself. We'll start with Commissioner Mac Bernard, then Commissioner Greg Weiss, and then Commissioner Maria Sax.
Thank you very much, Mayor. Mac Bernard, County Commissioner for District 7. When the mayor was going over this billboard, what caught my attention was the total capacity. We have over 2,823 beds in Palm Beach County, and over 3,033 are in use, which means that there's a negative 7% availability. The adult ICU capacity, 333 beds with 347 that are in use. Negative 14 are available, and that's a negative 4% availability. Our pediatric ICU capacity, 42 beds, 31 in use. Only 11 beds are available for our pediatric capacity. That means that if 11 of our kids that cannot be vaccinated, go into the ICU, if more than 11, then it's not going to be available for residents. After speaking with our hospital CEOs, what I got from it was the fact that we have a staffing shortage in the United States, in Palm Beach County, and in the state of Florida. Over 8,000 nurses, professionals, hospital professionals are not available right now. Our medical professionals are overworked. We have an oxygen shortage. And I have to tell you, we have to really, we're going to be celebrating Labor Day. We have to be thankful for all of our medical professionals who are working every single day, 24 hours a day, to protect the health and safety and the lives of our residents in the county. In the county, discharging is taking longer than normal. And our residents are getting very sick and they're dying. And also, they're going to have respiratory impact, after getting COVID-19. Residents of Palm Beach County, we need your help. We really do. We cannot do this without you. So we, as professionals are here, we're working hard every day. But it's the 1.49 million residents that call Palm Beach County their home that can help us beat this COVID. And how can you help us? Vaccination, as Dr. Alonso mentioned, we need you to be vaccinated. Continue to be vaccinated. There are kids who cannot be vaccinated, and you have to protect our kids. We're going to continue to provide testing in the county. We've opened the monoclonal antibody site in Westgate for our residents. We're opening new testing sites, vaccination sites throughout the county. Gaines Park is opening up tomorrow. So really, we're doing our part, and please do your part. Get vaccinated, continue to wear your mask, and practice social distancing. Thank you.
Good afternoon. I'm Greg Weiss, Commissioner for District 2. And after having an opportunity to speak to our hospital CEOs yesterday and administrators, it's clear that they're under tremendous pressure. The whole hospital system, healthcare system, is under tremendous pressure right now due to the fact that there's a normal healthcare that's going on in addition to what's happened because of COVID-19. If you think back a year ago when we first started with this pandemic, we shut everything down. Everything got shut down, so they had additional resources available to them. And people had to postpone very important surgeries and procedures. Well, they can't be postponed for forever, and those folks now are getting the help that they need so that they can overcome the illnesses they have. At the same time, we're seeing a surge of COVID patients, which has created this tremendous pressure in the system. Well, if you think about healthcare workers and the folks that work in our system, why do they do it? They do it because they want to help people heal. And what they're being put through right now is that they're seeing people that normally would be able to be healed that are dying. And that is emotionally very, very difficult. So I'm speaking for myself, but I'm sure I speak on behalf of our entire board, and to let them know that, number one, we support them. We thank them for their work, whether they're a nurse, whether they're a technician, whether they work in food services, whether they're a physician. It's a whole set of people that make our health system work. And they have been working 24/7 now for over a year and a half under extreme circumstances. A year ago, we would have parades going through the parking lots. People were bringing them meals. And we haven't forgotten, but I think sometimes they think we've forgotten. So thank them. If you see anybody, if you know anybody, thank them for their work. And I just want them to know we all appreciate your hard work and what you're doing to help keep us all safe and healthy. And then lastly, I want to close with, on Labor Day, we've got Labor Day coming up. Be careful. Every time we found that when we mix people together that normally don't mix, that's when we start to spread the disease again. So please be careful. If you're gathering together, maintain CDC guidelines, keeping yourself safe. And then to our Jewish residents, we'll be celebrating New Year's on Monday. I want to wish you a very happy New Year and a very sweet New Year as well. Thank you. And now Commissioner Maria Sax.
Thank you, Commissioner Greg Weiss. I am Maria Sax, and I find it rather sad that we're here again about a crisis that we had the solution in our hands within this last year. Can you imagine having a problem that is so severe that we have children in ICU pediatrics? Children. And we all had the answer in our hands. All we had to do is to get educated and get vaccinated. That's all. And because there are many who did not, for whatever reason, we have these kinds of numbers. These are not just numbers, ladies and gentlemen. These are moms and dads and children, teenagers. They didn't bring this on, nobody did. But to have the answer in our own hands. We live in an amazing country. How many countries out there today that would give anything to be able to have free and available and accessible vaccinations to protect them from one of the most deadliest viruses that this world has ever seen, certainly in our lifetime? And we had the answer in our hands. So let me say this. I'm very blessed to represent an area that has had probably the highest vaccination rate in the county and maybe in the state. But with that comes responsibility. So let us, all of us who have had the vaccination, make a commitment that if you are a parent and you have an eligible child who can get a vaccination, protect that child. Let that child be protected and get the vaccination. If you are parents who have children who are not eligible, get vaccinated to protect your little child so that they're not a number on this board. And teenagers, enjoy the beauty of youth, but get protected. Protect your friends. Get on Facebook, let everybody know how they can get a shot, how they can get protected. And grandparents, I'm speaking as a grandmother, make sure that your children and your grandchildren are protected. I don't want to see any more of these numbers. I don't want to come back here and talk about how many people are dying or have passed because the rest of us didn't protect everybody else. So let's make that commitment today. Every one of us who have had the fortune to live in this country and in this state and in this county, to have this kind of background behind me of everybody who is working together to make sure that we all are protected. Palm Beach County, let's get vaccinated. Now I'm going to pass back to our leader, our mayor, Dave Kerner. Thank you very much.
All right, well, thank you so much to my colleagues on the Board of County Commissioners for your comments and your leadership here today and throughout the pandemic. Make no mistake, we as a society and as a community and as a county are being challenged. Our educational institutions are being challenged. Our healthcare system is being challenged. Our way of life is being challenged. But what I can assure you is that we have the ability to move forward and progress. The hospital systems, I assure you, and this commitment has been made to each county commissioner and the county at large, they are available for healthcare, they're accessible, they are challenged in particularly, but it is a safe environment. If you need assistance of a medical health professional, we encourage you to go to the hospital and you will be treated and well taken care of. With that, we can take some questions of the fire chief, Dr. Alonzo, Ms. Baker. I also will they'll make themselves available after the press conference, each county commissioner, if you'd like to interview them, please solicit their input and interview them. Yes, sir.
Mayor Kerner, how do you convince the folks that are against getting the vaccine? It appears with these numbers that it isn't working. Is there some other way that you can come around to convince these people that is, in your eyes, the safest way to go about it?
Well, the question is, how can I convince somebody to get vaccinated? I can tell you and I can assure you after a year and a half as the county mayor that there's nothing that I can say or do to get someone to get vaccinated. I think at this point what happens is people should take, and I always hear about those that are hesitant about the vaccine, that they want to see the data, they want to see how people react to it. Well, you now have the results in that family members and friends are dying. These are not made up. These come right from the hospital system. So we know that if you're vaccinated, you're way less likely to end up needing intervention of medical professionals and be in the hospital. And we now know that having been vaccinated for so long, that we are generally healthier when it comes to COVID-19 than those that are not vaccinated. So I think at the end of the day, what encourages and convinces those that are vaccine hesitant are the stories of their families and their friends that are in the hospital, that are dying, the stresses of their friends and families that are healthcare professionals, that are overworked and stressed out and burnt out, and just the raw data that they've been waiting for, which is the vaccine and the vaccination process is very safe and in fact increases your health when it comes to COVID-19.
Mayor Kerner, you mentioned that there have been some
the hospitals themselves can do to entice or increase staffing in their particular hospitals. I don't have the answer for you. I think what I've gleaned from my conversations and just the market forces in play here is that there's a limited pool of healthcare professionals, particularly the nursing profession. They are being attracted and persuaded to other hospitals in other states for more money, or they're just leaving the profession altogether. So I would say make no mistake that at some point the demand for healthcare will exceed the supply of healthcare professionals. And so while there may be beds available, if you don't have a competent nurse or a competent doctor to care for you, well, the level and quality of care will be reflected in that, unfortunately. So I don't know that there's much to be done. I would leave that question answered by the healthcare professionals and administrators. All right, anything further? Yes, ma'am.
One more thing, and perhaps you, Mayor Kerner, perhaps Dr. Alonso, since we are at these negative bed numbers, I'm wondering, what are the hospitals doing? Are people lining hallways? Are they, like, if I went in today and there wasn't a bed available for me, would I expect that I would be in a hallway?
Okay.
That is a discussion we had with the administrators. I believe what they're doing is where it's appropriate to put extra beds, and that's why you're seeing that they can handle more, and calling in the appropriate staff so they can also have staffing with beds. They are putting them in places that they normally would not. Surgical centers or areas, and other appropriate areas that can handle the ventilators and all of the other equipment that would go with taking care of COVID patients.